Hello, my name is David Trimberger. This is Molly Hall. She's going to be helping me out today. We are going to be doing my peer-to-peer second attempt for trauma adult physical assessment. Let's go.
You are dispatched to a 23-year-old female who was assaulted.
Cool. What are the credentials of the partner on my truck?
EMT.
Cool. What time of day is it?
8 p.m.
8 p.m. Where am I being dispatched?
Section 8 housing.
And then, what's the weather like outside?
Sunny and hot.
Sunny and hot. Has police already been dispatched to the scene?
Yes, and they have apprehended the perpetrator and cleared the scene.
Okay. So then in that case, BSI is my scene safe?
Yep.
Okay. How's my patient presentation?
Sitting in the living room chair holding a towel over her eyebrow.
Okay. Do I notice any sign of obvious bleeding?
No.
Okay.
Wait. No.
No? Okay. You sure? Alright, so no signs of obvious bleeding. Does my patient look at me whenever I walk up to her?
Yes.
Okay. So going up to my patient, hi, my name's David. I'm with whatever EMS. What's going on today?
I was trying to put the baby to sleep when the guy came out of the bathroom and he punched me.
Well, I'm so sorry to hear about that. How many times did he punch you?
5.
He punched you 5 times, and it was just in the face?
Yeah.
Okay. Let me talk a little bit louder if you wouldn't mind.
I was coming up with that.
No,
Yes.
no, you're good. The only reason why I say that is just so the computer can hear you. But, so he just hit you in the face?
Yes.
He didn't hit you anywhere else?
No.
Do you feel any back, neck, or chest pain?
No.
Okay, a couple questions I gotta ask you real quick. Do you know where you're at right now?
My home.
You're at your home? Okay, do you know what day it is?
Yes.
Okay, can you tell me the day?
Sunday, July 5th.
Okay. Do you know who our president is? Okay, and then if you had 4 quarters, how much money would you have?
$1.
Okay, perfect. Would you mind opening up your airway? Perfect. Is my airway clear?
Yes.
Gonna go over and assess her breathing pattern. Is her breathing pattern fine?
Yep.
Okay. Gonna feel for a carotid pulse. Does she have a carotid pulse?
Yeah.
Perfect. Okay. Next, I am going to talk with my patient and be just kind of like, well, are you wanting to go to the hospital or?
Yeah.
Yeah, what hospital do you want to go to?
St. Anthony's.
You want to go to St. Anthony's? Okay, well, we can definitely do that for you. Well, why don't you go ahead, let's get you out of this environment, let's put you on my stretcher, and let's get you in the back of the truck. Is that okay?
Yeah.
Okay. So we're going to go ahead, put her in the back of the truck, and then I'm going to kind of do like a brief overview of my patient, see if I notice any obvious signs of bleeding or any other like major deformities that stick out. Do I see anything just immediately sticking out at me?
Just a small laceration.
Just a small laceration. Okay. So now what I'm going to do is instruct my EMT partner to go ahead and connect my patient to the monitor and get vitals. So I'm going to be looking for a heart rate, blood pressure, SpO2. Going to go ahead and connect her to a 4-lead and get a blood glucose. So just starting from the top, what is her heart rate?
78.
78. What is her respiratory rate?
16.
What's her blood pressure?
120 rain.
And then SpO2?
97 on room air.
And then what is her 4-lead show?
Normal sinus.
Okay, and then what is her blood glucose?
95.
95? Okay. Perfect. So then from obtaining all that information, I'm also going to do a sample history and do a rapid trauma assessment. So I'd be doing those at the same time, but just to help kind of explain for this skill, I'm going to start off with my sample history. So I'm going to ask my patient if she has any known allergies. Do you have any allergies?
No.
Do you take any medications?
No, right now.
Do you have any past medical history I need to be knowing about?
I mean, I gave birth, but that's about it.
Okay, when did you give birth?
6 months ago.
6 months ago. Is this your first pregnancy?
Yes.
Okay. Have you ever been pregnant before? Or was this your first time pregnant?
First time.
First time pregnant, and this is your first baby?
Yes.
Okay. And then you said that you were just trying to put your baby to sleep, and then.
Yeah.
Okay. Gotcha. So as I'd be going through that information, I'm also going to be doing my rapid head to toe. So I'm going to start from the top, feeling through her scalp and her hair for any signs of decap BTLS. Do I feel anything on her scalp?
Nope.
Okay, moving down to the facial regions, going to check for a pupillary reaction. Does she have perla?
Mhm.
Okay, is the nose in line?
Yes.
Okay, looking at the ears, looking behind, is there any black and blue marks or drainage coming from the ears?
No.
Okay. Any damage to the oral cavity?
Mm-mm.
Okay. And then you said that she just had the one laceration on the what
Right eyebrow.
on the right eyebrow. How big of a laceration is it?
About an inch.
About an inch. Does the bleeding seem to be controlled?
Yes.
Okay. So next I'll be going down to the throat. Is there any signs of JVD?
Nope.
Okay. Is the trachea in line?
Yes.
Going to go down to the chest. Is there sternum in line?
Yep.
Rib cage look to be intact?
Yep.
Okay. Any signs of contusions or abrasions from or any decap BTLS? Okay. Going to be listening to her lung sounds in all lung fields. Normal. Okay.
Equal and bilateral.
Sounds great. I'm going to go over and palpate her abdomen, all 4 quadrants. Normal. Okay. Is her pelvis stable?
Yep.
Okay. Then I'm going to be checking for circulation, motor, sensory in all 4 extremities. Is that present? Okay. Any decap BTLS to any of the extremities?
No.
Cool. So after obtaining all that information, then what I would do is I would go ahead and I would call report to the hospital. I'm also going to talk to my patient and find out if she's in any form of pain. Do you feel any kind of pain anywhere? Or if you could rate your pain on a scale from 1 to 10, how would you rate your pain?
A 4.
About a 4? Okay. So after I'd find out that information, then I'd go ahead and I would give report to the hospital. After giving report to the hospital, I would then monitor my patient every 5 minutes en route. Is there any change in patient condition en route to the hospital?
No.
Okay. Does the laceration seem to be maintained while I'm en route to the hospital? Does it reopen or continue to bleed?
Mm-mm.
Okay.
Controlled.
En route, I'm going to go ahead and try my best to bandage up the wound and kind of clean up the area so whenever we get her to the hospital, it can be prepped and ready for the nursing staff. Once we get to the hospital, I'll go ahead and give report at the patient bedside and transfer care to St. Anthony's nursing staff. Thank you.